So I think for this video, we'll talk about male hypogonadism, because you can have male or female. But male hypogonadism implies a loss of sexual function because of low sex hormones. And in the male case, it's a loss of testosterone. And testosterone is a steroid hormone that circulates in the bloodstream and is responsible for very powerful effects on the body, both during puberty, when you're progressing from a boy to a man, but also later on and throughout the whole of life for sexual function. So there are many different effects of having low circulating testosterone that we'll probably come on to, but hypogonadism is essentially the term for the clinical presentation of someone with low circulating testosterone level. Hypogonadism in a man can be caused by many things. The first thing to do is to confirm the diagnosis, because it's quite common actually for men to have a slightly low level of testosterone without needing replacement. And the sorts of things that are associated with that are obesity, so particularly abdominal obesity, as well as diabetes. And so it's quite common that people that are overweight or with type 2 diabetes have a low testosterone. And that can be a more difficult question about whether that's an association or a cause or effect. But if you like, the classical causes of low testosterone and hypogonadism are either because of loss of function of the testes or the testicles that produce testosterone. And there are numerous reasons for that, both things that you inherit and things that you can pick up along the way in life because of disease processes, as well as a problem with the pituitary gland, which is the main gland at the base of the brain that actually controls all the hormones, including the testicles producing testosterone. And there can be numerous causes of that. And there are ways of interpreting the blood tests that we would do in an endocrine clinic to try and work out, A, whether there is true hypogonadism that needs treatment, and also what the cause is. So in men, or male hypogonadism, the signs and symptoms depend upon the age of presentation. So, for example, in pediatric practice or in teenagers, the first signs will be not going through puberty. So that would be loss or lack of development of the facial hair or chest hair, lack of increase in size of the testicles, lack of deepening of the voice, and lack of sexual development. And that's often apparent at school, and that can present with delayed puberty when you're not developing as quickly as peers. That can present with short stature being short, because when people go through puberty, they often sprout up in height. Conversely, if people have a really low testosterone for many years, they can carry on growing, because when you go through puberty, you stop growing. So sometimes people in their late teens and 20s can be quite tall compared to their parents if they've got a low testosterone. And there are some genetic conditions such as Klinefelter's syndrome, where you have an extra X chromosome. So that's in teenagers and young adults, but then far more commonly later on in life, which is really the epidemic, if you like, of low testosterone, which is partly driven by the testosterone making companies, because many people go looking for it. It's much more subtle, and it can present with loss of sex drive. The three classical sexual symptoms are loss of libido, loss of early morning erections, and erectile dysfunction. But it can present with very vague symptoms such as feeling depressed or low muscle mass. And so it can be quite non-specific and can present almost indistinguishable from depression. So it's important to look at the patient and to see whether they've got loss of the secondary sexual characteristics. Some people get gynecomastia, which is increased breast tissue. And so it requires a detailed history and then investigation after an examination. For all intents and purposes, yes, male hypogonadism really is saying that this is the clinical presentation of a man with a low circulating testosterone. The term is probably overused, and so there are some people that have hypogonadism that don't need testosterone replacement. So it depends who's calling it hypogonadism. But if an endocrinologist refers to male hypogonadism, they're essentially saying that this is low circulating testosterone, but what it's not doing is saying what the precise cause is or what the precise treatment would be, which would be very cause specific actually, but may well lead to testosterone replacement, yes. So it's important to treat true male hypogonadism for two reasons. One is to improve symptoms. And so if the symptoms are delayed puberty, then giving a small amount of testosterone might take a teenager through puberty. It's important later on in life to improve sexual function, erectile function, and secondary sexual characteristics and muscle strength. And so if it's left untreated, the symptoms will not improve, and some people get terrible hot sweats similar to the female menopause. In patients that don't have symptoms, it's still important to treat, because if someone has a very low testosterone for many years, the sex hormones like testosterone are very important for the strength of bones. And so if you don't have testosterone treatment for many years, then that can lead to osteoporosis, which is brittle bones, and means you can break your bones very easily with just minimal trauma. And so it is worth looking at a bone density scan, even if you have no symptoms, to make sure that giving testosterone will not prevent the onset of osteoporosis or thin, brittle bones.